Yeah.
All right, thanks for taking the time to stop and talk to us.
Yeah, you're
Really
welcome.
appreciate that. So we started back with you more than a year ago, I guess, right?
Yeah.
And do you remember what it was like when you first came to see me?
Yeah, when I had to walk up the stairs to come up here, it was quite painful, and even like just getting out of bed or standing up from sitting in a chair, and just basic everyday movements were painful when they shouldn't have been.
Mm-hmm. And most of that pain was where?
Just back in my SI joints, mainly my, I guess, left one then.
Mm-hmm.
And then once we got that fixed up, my right one was kind of starting to get sore.
Mm-hmm.
So.
And do you remember what caused that condition?
There wasn't really a specific time, but just from being active and playing sports or getting bucked off horses or figure skating and.
Well, that's right. Yeah, you're pretty active. So.
Yeah.
So the sprain could happen on any number of things there. And how long had that problem been bugging you when you come to see me?
Since grade 12, so it would have been a couple of years.
Okay.
I think.
For most people watching you, they probably think that was last week.
Yeah. So
a couple
2 years, yeah.
Okay, good. And so we did the Shockwave on you, but we also aligned the spine because the two of them went hand in hand on that particular thing.
Yeah.
And I remember when you first came in, I thought you were actually about 80 years old, but you were moving like it anyways. And then we got the spine straightened out, and you had some good improvement there.
Mm-hmm.
And then when we did the Shockwave, you had even better improvement. So what were you able to do after the Shockwave that you weren't beforehand?
So I wasn't able to do any type of running or exercise really. I wasn't playing any sports or doing any of the activities I normally would have been doing. And then after we started the Shockwave, I could run again and play sports and exercise and all of that, usually without pain. And if there was, it was so small that, it wasn't really a factor. So.
And when we went through the Shockwave too, you didn't really give up too much there, did you?
No, I didn't.
You still went out and tried to do these things, and
yeah.
It wasn't like you were bed rest for
no,
procedure.
Definitely not. I was still doing things, even if it probably wasn't the smartest thing to do. I still did it.
And you still recovered?
Yes.
Yeah. And now the stability's been really good.
Mm-hmm.
And
yeah.
You've been in a Spartan race?
Yep.
Have you done any other racing or
I did
big activities?
the mud race here in Lethbridge, and just playing softball twice a week and hiking. So I've been able to start being more active.
Great. And have you had any problems at all during that?
Not during. After it might just get a little bit tight, just sore muscles more than anything, I think. But it's been really great.
Good. Good to hear.
Yes.
So thanks a lot for taking the time, and we really appreciate that.